Ready to start? Okay.
All right. Well, I want to welcome everyone to our first virtual Meet the Candidate. I'm Ann Jesse, the current AAACN president, and I want to thank you for joining us and for taking time and interest in our 2021 Board of Director candidates. I'd also like to give a shout out to the current Board of Directors who are present today on the call, Chris Graham and Kathy Mertens, and you want to give them a wave. Now I'm going to hand it over to Chris Graham, who's the immediate past president of AAACN and the nominating committee chair. So Chris, take it away.
Thanks, Ann. This year, you'll be voting to elect 2 board of directors for the 2021-2022 year. I'm going to introduce our candidates in alphabetical order, which is also the order they'll present. They'll each have 5 minutes to tell you a bit about themselves and why they're running for a director position with AAACN and why they'd be a good choice. Nicole Demers and Jennifer Stranix, both with the national office, are also on the call to answer any questions you may have and to help facilitate candidate questions. Candidates, I'll let you know when you have 1 minute left. After 5 minutes, we'll open it up to specific questions for the presenting candidate. Everyone watching and listening, to ask a question, please use the chat feature on the top right-hand side of your screen. And Nicole and Jenny will ask the questions to the candidates through the chats. Once everyone's given their presentation, we'll open it up for general questions for any of the candidates for 15 minutes. A few rules of engagement. Please mute yourself on the option to view at the very top of your screen in the middle. There's an option to choose who's talking. So please select the who's talking option to give the candidate your full attention. Please remember to use the chat feature to ask a question, speak, or if you need clarification. This year's candidates are Mary Blankston, Andrea Petrovani Green, Rachel Start, and Stephanie Whitwer. And we'll start with Mary Blankston.
Perfect. Thank you so much, Chris, and just to all the leaders of AAACN, and of course to all the members who will be viewing this either today live or on the website. Just really want to thank you all for the opportunity to be here and to speak to you. I am a family nurse practitioner by training and actually began my career about 16 years ago. And I work at Community Health Center, Inc., which is a federally qualified health center, and we are the largest FQHC in the state of Connecticut. We serve a little over 100,000 patients across the network. And I actually started working there as a new graduate family nurse practitioner as a primary care provider for 9 years, moved into the role of the medical director. And for the last 6.5 years, I've been in the role of the chief nursing officer. So I've had the absolute privilege of leading our medical assistant staff as well as all of our registered nurses and our licensed practical nurses. And it has just been wonderful. My staff number about 182 across our network of primary care hubs that are fully integrated with behavioral health and dental, as well as our school-based health centers and all of our healthcare for the homeless sites and mobile locations with farm workers and other groups. I'm proud, really proud to be a member of the FQHC community. I often will brag that we are the largest health system in the country with more than 1,500 FQHCs serving those that are disproportionately affected by chronic disease and issues with social determinants of health and other issues across the country. I think in my work with AAACN, I've always brought that as a unique perspective in all the presentations that I've done since being a member since 2016, just talking about how challenging it is to deliver high-functioning primary care that is of the utmost quality and really making sure that it is a human right for every patient that we serve and not just a privilege for a very few to have. In my work with AAACN, not only have I presented at many of the conferences, but I've had the privilege to be able to contribute to some of the work on the Care Coordination and Transition Management Toolkit by giving my feedback about what that looks like, particularly from a leadership standpoint as a CNO. And then also had the opportunity to be a part of one of the town halls 2 years ago when we talked about the opioid crisis, as well as social determinants of health, and just how nurses play a very key role in making sure that we collect this data and information so that we can better understand what the challenges are that our populations face. In the last year, I had the great privilege of being invited by Nancy May to join a group of executive leaders that were working on sort of the nurse leader or nurse executive toolkit that had the opportunity to look at AONLs, or the American Organization for Nurse Leaders, look at their competencies and really translate that to the ambulatory space, which is so very important. You know, I've only been a leader in the ambulatory space as a CNO for the last 6.5 years. And frankly, I have learned so much, and our role is so very different than many of the other organizations or other service delivery types that I've seen. Even just today, I was pulled and I helped out COVID testing, and I've performed close to 200 tests already this morning, and just had to take my mask off long enough to get freshened up to meet with all of you. And I just know our ambulatory care nurses all across the country just do so much every single day to care for our patients, the patients who are at home, who are trying to stay well, particularly during this pandemic, not just from a medical standpoint, from a behavioral health standpoint, and so many other spheres. So it really would be an absolute privilege to be represented on the board of directors, to bring the unique experience that I have from the primary care space in particular, and particularly from federally qualified health centers, as we are very engaged in value-based care, have been for a very, very long time, informatics and other things because of the grant requirements that we have through the federal government. I will also just comment, I've done a lot of work and a lot of the things that I've presented at the conference around implementing primary care dedicated education units, just to support there being a space for trainees and students to have the opportunity to learn about an entry to practice in primary care as a registered nurse, and just how wonderful that is. And also, of course, the work around complex care management project ECHO. We implemented the first registered nurse-centric project ECHO to be able to support nurses to build new competencies that aren't necessarily taught during their baccalaureate training. So how to care manage, how to have those conversations around chronic diseases. Those competencies are certainly some of the more challenging to manage. So Chris, I set a timer that you just heard, I'm sure, so I am at time. But really, thank you so much for just the privilege of sharing a little bit about myself with the membership, and I look forward to continuing the conversation.
Mary, thank you so much. I think it's great for the membership to be able to hear a little bit about you and to be able to ask you some questions.
Yes, thank you, Mary. So I have a question for you. What do you see as the future of AAACN?
I definitely see, you know, the future of AAACN. We are so perfectly positioned to continue to grow our membership and to really be the prime resource for all of our ambulatory care nurses, as well as all of our leaders across the country, and even non-nurse leaders, to really understand the benefits and the value that we bring to the table, particularly, as I said, during the COVID-19 crisis, during the work that we've done in social determinants of health and the opioid crisis, the work that we've done, and even just, you know, developing these high-functioning team-based models of care that we've designed and implemented in all of our settings. We also have been kind of the first group to be able to share specific curriculum and competencies that universities and academic settings across the country can really utilize to revolutionize what nursing training and nursing education looks like to prepare the nurse of the future. And I just see AAACN continuing to grow in that mission, and to really make sure that we have that firm seat at the table. If you think about sort of the overall care continuum, I mean, ambulatory care really is the largest part of the care continuum. Patients spend the majority of their time at home engaging in care with us, not only in person, but now so much more in the telehealth space. And AAACN did that first, right? Having all of that work already out there for telehealth nurses to be able to engage and to activate with. And so I just continue to see AAACN just really having their ear to the ground, hearing what do our nurses, what do our nurse leaders need, and being able to deliver on that, to give them the support and the structures and the mentoring that they need to be successful.
Thank you, Mary. Also, as a director, you'll be assigned as a board liaison to a particular special interest group. How would you encourage our members to participate and or get involved with your group?
So I think definitely for me in my nursing career, there have been many doors that have been opened for me so many times that have allowed me to really experience all that I've experienced as a leader. And I think it's just a great opportunity to get to know new people. And I think whatever special interest group I'm interested in, my job is to really listen to what the issues are and the things that interest them, and really to encourage them and mentor them to know their voice, and to maybe navigate for them how they can share that and how they can better engage to make sure that their perspective and all the things that they have to say are really heard and valued then by the larger leadership. So I think really just by effective listening, even saying back to them what I'm hearing, and maybe even helping them to ask bigger questions, or really to think outside the box in sort of how those questions or how those concerns that they're really experiencing at the front line, how that can potentially turn into larger initiatives, or maybe even policy things that we take on here at AAACN. So I think my role is really navigator, welcomer, and mentor in so many different ways.
Thank you so much for that, Mary. And now we're going to hear from our next candidate, Andrea Petrovani Green.
Aloha, good morning, good afternoon, good evening, everyone. Thank you so much for this opportunity. I have to say that it is truly humbling to be amongst esteemed leaders, amazing careers. And I'm just sometimes, honestly, I'm taken aback just to pause and reflect on how grateful and how fortunate we are. I hail, just a little bit about myself. I hail from the beautiful island of Trinidad and Tobago. So if you hear my mix of accents, it's from there, that journey my life started, and immigrated here when I was 13 years old to first Boston and then New York. I always knew I wanted to be a nurse. I was raised by my grandmother, who took my little hands, and I made rounds with her to the neighborhood. So that was my first influence, and I thank her today because I am who I am because of her. Service is what I do. I have been a proud Navy Nurse Corps officer for 27 years. This is my last assignment, and it's just been so fulfilled. But I know there's greater and there's more, and there's another chapter. AAACN I am because where I am today, I owe really all my credit to AAACN and the mentors I've met along the way. My first experience, actually in high school, I enrolled in the LPN program. So I graduated from high school as an LPN and embarked on a journey where I received a scholarship to complete my bachelor's through the Navy program. It was called the Bachelor Degree Completion Program at the time. It's no longer as an option, but I started my journey, and I will tell you, just the mentors and the people along the way who have saw something in me that I honestly didn't see. So being here today, honestly, is just, I'm just grateful. My mantra is pay it forward, and greater service, greater progress. I bring to you a diverse background. I started, actually Guantanamo Bay was one of my most memorable assignments, because I was assigned there to take care of the prisoners, and I was one of the first females behind the wire. And that was quite an experience, but I tell you, the Navy Marine Corps team is just amazing, and at no time did I feel like my life was in danger, but I felt so protected. With we're a team, and we're one team, one fight, and that's what I've done my entire career. I think that's what I'm best at, is bringing teams together and truly having the team understand their value and what they bring to the table. have a lot of amazing positions along the way. I was in Okinawa and was the director for branch clinics. I worked closely with the Marines. That was a tough job. Those Marines are tough. And so to go to the table as a female sometimes is a little bit scary, honestly. And you have to put on your big girl pants and, you know, show them who you are. So sometimes I just had to be like, there's no smiling today, Marine. We're getting the business done. I need your Marines to do what they need to do. They need to come to the clinic and get their readiness. So that was a pivotal point in my career, whether I continued on in executive medicine. And I made a decision then to stay nursing. I am a clinical nurse specialist by training. I graduated from Catholic University under the tutelage of Sister Rosemary Donnelly, where I studied care of the vulnerable populations. And again, an opportunity to truly give back in communities where I can relate to, because that was my upbringing. And so it was for me going back home and giving back the privilege that I've had along the way. AAACN, I've been a member for over 20 years. Mentors like Captain Wanda Richards, who's retired, and Captain Deb Janikowski, they took my hand as a little pup and said, hey, you know what, we see something in you. Captain Janikowski wanted to change the position of nursing in the military. So I was actually a guinea pig or a pilot or an innovator, if you will. Very young, lieutenant junior grade, and she wanted to try something new. And she said, let's send our nurses to the ambulatory care. I trust that they will do well and we'll take care of them. And so that was my first experience working in the orthopedic clinic. And wow, the world opened up because I loved the advocacy. I love the autonomy. I mean, I am a med-surg nurse through and through, but this afforded me the opportunity to really feel like I was championing for patients and making those connections. And you didn't realize it at the time, but it was case management. A lot of it was putting the pieces together. And so a lot of what I reflect back on, I didn't know what I didn't know. And I'm humble enough to admit that. And I'm still learning. That's the beauty of life. And AAACN has provided amazing mentors, a lot of wonderful tools. I will tell you today, I've been here for about a little over 4 months. And at noon today, I have 7 nurses that is going to be part of our review for the ambulatory care certification exam. So this is something that I look at opportunities to really give back and be a force multiplier and lead by example. And I have my own style, we all do, we have our diverse background, but I know what I'm good at and I know what I really suck at, and I'm okay to admit it. And I think that's the first part of the battle, that you said, I'm okay at this point in my life to admit that, hey, you know what, that's not for me. But I'm also willing to venture out and try different things and be uncomfortable, be comfortable being uncomfortable. So that has gotten me through a lot in the military when, you know, people don't believe me, but I'm an introvert. I really have to have my quiet time. I have to my down. They're like, no, but you're so outgoing. I was like, and when I get home, I don't talk to anyone. I just need to totally refill my cup. And but that's my best time as well in terms of reflecting and thinking about, okay, what I do good today? What's the lesson learned? You know, and just really take that and now pour that into how to better myself and how to be a better version. And more importantly, how to give back and take constructive criticism and use that to make myself or look at that aspect of things that I can change. But my focus is always giving back. And so all in all, I will bring it back home. Over 20 years as a member of AAACN, the journey has been amazing, and I have no intention of stopping anytime soon. I remember a quote from one of my captains. She said, I have so much to do that I will never die. So I'm continuing the journey. It was a little bit of trepidation in deciding to run because I'm all the way in Hawaii. So I've actually gotten up for Joint Commission training at 2 o'clock in the morning. And my husband thinks I'm crazy, but like, you do it every time. And I'm just proud and amazed at you because you show me that if you want something, you go get it. So what I bring to you is dedication, commitment. I like to have a fun time. I love to laugh. I love to, you know, put people in a position where like, it's okay to be silly and it's okay to fail and it's okay to have a good time. So let's have a good time. Let's learn together and let's take care of each other. And that's my thing. As far as some of the big picture items and the strategic 2023 strategic planning and the imperatives that you have, the goals, I think they're well listed. Yes, ma'am.
Thank you so much. We're
Thank
at
you.
time right now, and so we're going to move on to some questions that are in the chat box for you.
Absolutely. Thank you.
My apologies, I was muted. One of the questions that we have, that wasn't you, that was me.
Okay.
Is the board, you had just started to talk about it. The board just released the new strategic transformation plan. What component of it resonates the most with you and why?
So I don't want to misquote, but it has to do with equity and inclusion. I know it's a goal that's still being worked on. And why? Because I think at this moment in time, where we are in this country, that is something that we need to embrace and get very uncomfortable about. And I think people shy away from it depending on how it's introduced. But it really, truly is a pivotal time where if we don't get this right, I just can't say it's not going to be something that we can figure out and try to make it right somewhere down the line. We have to get it right now, and now is the time. And I'm that person.
Okay, thank you. And the other question I have for you is, Nicole had talked to Mary about it. As a board of director, you'll be assigned as a board liaison to the special interest groups, our SIGs. How will you encourage our members to participate and get more involved with the groups? What are your ideas?
So I've started doing that. I think I've been doing that all along the way because I talk AAACN all the time. As a matter of fact, I just loaned my books out yesterday, the core curriculum and telehealth. And every opportunity I get, because I'm so passionate, I believe in what we do. I believe in our mission. I believe that we are going to set the world on fire as ambulatory care nurses, because at the end of the day, with the current situation, we have learned, wow, you know what? We have to adapt and overcome, and pretty quickly. And that really puts the focus on ambulatory care nurses, because we do it well. And we should applaud each other because we do a really, really great job. But the tools that we have in terms of moving forward and what we could, as a board of director, I will definitely embrace the opportunity, first of all, to learn. I like to listen and learn because I feel I have so much to learn from all the esteemed leaders and those who have gone before us to build this wonderful continuing bridge that we're building, bridging a lot of gaps and understanding people to understand exactly what we do, because sometimes it might be difficult to put into words because you do so much. And sometimes I reflect and I was like, well, what did I do today? And I'm like, oh, wow. And then you realize, oh, my goodness, I made such a difference because I was able to get this patient the right care at the right time for the right reason with the right provider. And so working in that, as along with the strategic goals, is to mesh in those with the mission to how they interlock. And then my part of that is truly working as a team, working with the team, so we make the best decisions moving forward. And that is only accomplished with a team. So I am just going to be part of that team, helping along the way, bringing what my talents are, but certainly tapping in on all the amazing talents of the board of directors and the leaders and the mentors and the advisors. So together, I feel what I bring from the military perspective as well, my experience in diversity, in inclusion, in moving women to the forefront, especially women of color. There's a lot of talent out there that we haven't tapped into. And it's only because sometimes you just need a door open up to you, just an opportunity. And so opening those doors and really reaching out to those individuals who all they need is a nudge to say, hey, you can do this, and bring them along. So mentoring is key. That's my mantra, pay it forward. And that's what I'm all about, because one day we will leave and move on, and we want to look back and see, wow, the success of the organization continues. And I was a little part of that. Thank you.
Thank you so much, Andrea. Our next candidate that we're going to hear from is Rachel Start.
Hello, my name is Rachel Start, Director of Ambulatory Nursing and Nursing Practice at Rush Oak Park Hospital. I'm honored to be running for the American Academy of Ambulatory Care Nurses Board of Directors and amongst this esteemed group. For years now, there has been a high-level authoritative call for nurses to respond, lead, and transform healthcare. Pre-COVID, the underperformance of the healthcare system was focused squarely on the care of diverse, chronic, complex patient populations that in many cases suffer from social complexities such as lack of fresh food, transportation, access to care. COVID sped up the nation's cognizance of social disparity, the complexity of healthcare, and the prevailing burden of poor outcomes. I always sort of refer back to in my brain a mission call from the 2010 IOM report that talked about that we were supposed to, even at that time and years before, lead in the improvement and redesign of many practice environments across the continuum to bridge the gap between coverage and access to enable the full economic value of our role in all settings. And that report called out the continuum. It called out the ambulatory nurse who sometimes knows a patient for 40 to 50 years of their life. It called out the need for care coordination and population health, for assessment, intervention, partnership to solve social determinants of health. As value-based models have now been unfolding, there's even more emphasis placed on our setting. AAACN has been a major catalyst to realize transformation up until this point. It has met the call to equip ambulatory nurses to be change agents, to lead, to inform their emerging science with meaningful data, and to improve their excellence through structures such as the Magnet Recognition Program. In 2013, in seeking to empower nurses in my own organization, I realized our ambulatory nurses were not included in structures such as shared governance, didn't have meaningful data to improve care, and were not involved in professional development mechanisms. I reached out somewhat on a whim to AAACN to seek assistance. And ever since, myself and my organization have been benefiting from the empowerment, resources, and structure developed and envisioned by this specialty body of nurses. At that time, I also had reached out to a handful of other leaders in Illinois to see if they would want to pilot nurse-sensitive indicators in ambulatory care. Reaching out to AAACN was the first action step of that meeting. After that group became the Illinois Ambulatory Nurse Practice Consortium, which shortly thereafter became a local networking group of the AAACN. And in doing so, we finally gained a seat at Illinois policy tables representing ambulatory nurses in subjects such as the Nurse Compact Act and State Practice Act. Additionally, in my reach out to AAACN at this time, I discovered that a new task force had been formed related to the identification and development of nurse-sensitive indicators. I was happy to join and start my journey on that work at that time. By early 2014, I attended with others from this group the ANA Special Ambulatory Summit. By 2016, we had concluded a 3 years long work on identification and development of measures, which culminated in the publication of the industry report, which I'm thrilled to see has been downloaded over 3,000 times, just amazing. This report and initial work catalyzed us into a pilot process for the next 3 years. And I do want to call out my co-chair, Dr. Anne-Marie Matlock, and the president at that time, Nancy May, really supported this work going forward. We ended up piloting in over 150 organizations in the country these measures. The database that was formed created a benchmarking structure that was then acquired by Press-Gavy in 2019. And we're still at the early point in this science, but there is so much good work to be captured, and truly for transformation to occur, we must understand our contribution and be able to study it so that we can continue to perform it. Throughout this journey, I've had numerous opportunities to meet folks working and advancing our specialty. Our community in AAACN is strong. We're supportive of each other. We're focused almost uniformly on advancing our nursing to top of scope so that transformation of healthcare in our environment can occur for patients. Several other offshoot items arose from the NSI work. I was able to advocate to the ANCC Magnet Commission in 2016 on ambulatory elements. I've continued to work with CalNOC in various strategies to advance their research strategies. In addition, I joined the AAACN Nurse Exec Task Force, which Mary mentioned earlier, and it's been a really awesome experience to try to put together a toolkit that can equip nurse leaders to have an equal seat at decision-making tables in structures across the country. And finally, throughout any of my other work in professional organizations, I also serve on the AONL Care Continuum Committee, the AACN Nursing Essentials Task Force, the AONL Dynamic Leadership for Shared Governance. And at these venues and others, I constantly advocate, advance, and rely on the strong work heavily produced by AAACN. I've promoted the role papers, the definition of nursing and ambulatory, the CCTM work. These structures are advising other organizations on our environment, and they are absolutely essential. Because AAACN is a specialty organization of ambulatory, promotion of our organization advances and strengthens the voice of ambulatory nurses, which in turn improves the care of the many populations that so critically need it. I have been impacted by this membership, and I'm putting myself forward to serve in this new role. I would be thrilled to continue to contribute to this organization through this new role, because I believe AAACN to be absolutely vital to our advancement of nursing in this setting.
Thank you so much, Rachel. All of our candidates are doing such a good job staying on time. I'm not even having to let you know when you have 1 minute left, so thank you. Now we're going to switch over to some questions that the members have for you.
Thank you, Rachel. So I have a question for you. What specific strength would you bring to the board of directors in relation to the role description?
So, as I mentioned, our network and our community, I feel like because I've been able to connect with leaders in multiple organizations across the country, and because I've been able to advocate for ambulatory nursing practice as well as the AAACN, products and structures and other professional organizations, I think one of my strengths is my network. I think in trying to see, for instance, the work that's happening to support nursing education, to weave in elements of the CCTM into that, right? In any work that we're doing to continue research of nurse-sensitive indicators, that's not only within AAACN anymore, that's in multiple organizations in the country that need mentorship. As anyone pursues Magnet, I think that my ability to be in touch with a lot of other organizations and trends and leaders, I think that would be a support to this role, in informing the board, but also in looking to leverage certain strategies that AAACN can offer as a leader with those other orgs.
Thank you. Another question for you. What goals would you like to advance for the organization?
Well, I'm certainly immersed in value description, as you know. I'm certainly very interested in identifying really the return on investment for ambulatory nurse in the different capacities that person can serve in. I think that in that pursuit, we've got to be ahead of truly showing the contribution that ambulatory nurses make in the community as a central touch point to their patients for many years of their life. And we're still struggling 6 to 7 years after the work of this nurse-sensitive indicator identification to actually show the science and what's the correct dose of an ambulatory nurse, for instance, in a clinic. We're still struggling to connect the staffing mix to the various quality outcomes. And I think beyond ambulatory nursing needing that, our physician partners would like to have a better understanding of how to leverage us. I think our organizations really are in dire need of understanding who we are and what we bring. So I think that is certainly something that I think is absolutely essential in our environment currently, as well as for our profession.
Thank you, Rachel.
Thank you.
Thank you, Rachel. Now we will move on to our fourth and final candidate, Stephanie Whitwer. Stephanie?
Thank you, Chris, and thank you, Jenny, for this opportunity to speak to the membership. I kind of wish right now that I had adopted my maiden name, which would have put me before some of these great speakers. It's amazing, as I think Andrea pointed out, to the depth and breadth of the experience that our potential leaders are showing in this conversation. I'll tell you a little bit about myself personally first. I was born and grew up in North Dakota, and I'll try really hard not to do the you betcha thing with any of my presentation. I spent most of my professional career there. I'm married and have 2 adult children and a wonderful 3-year-old granddaughter. I received my baccalaureate degree and master's degree in nursing from the University of North Dakota and my PhD from the University of Northern Colorado. I was lucky, very lucky at that time, to be one of the first nurses who were part of an primarily online educational program for my doctoral program. And living in a very rural part of the country at that time, having access to online education was an incredible resource for me. And we can see how that resource has been extended now and to many people in the country. So I was very appreciative of the actions of the University of Northern Colorado. My clinical work has primarily been in post-surgical areas and home health. So when I was a post-surgical nurse, developing discharge plans for patients and putting together those great education plans, I thought I was doing the greatest thing ever. And then when I became a home health nurse, I realized the disparities and the differences and the life circumstances that really impact patients' lives. You can have the best plan that you've developed, and it might be perfect in every way. And when you get home and that patient can't afford to fill those prescriptions, or potentially doesn't even have heat or running water, the adaptations that they need to make to that discharge plan really affect their ability to carry through with it. And I think that was probably my first experience in a setting outside of an inpatient setting. After that, I worked for about 10 years in our local university system, both as academic faculty teaching undergraduate baccalaureate nursing students. I was kind of part of that med-surg faculty, which I always considered kind of the backbone or the foundation of education for nursing students. And then I moved into an administrative role at the university, working with online programs and also working with continuing education, and always reaching out to our Department of Nursing to help with their strategic planning and some of their clinical efforts as well. But I found that I was missing being in healthcare, so moved back into a healthcare position, became a chief nursing officer in a community hospital, part of a small Catholic organization. We're, again, rural community, so our hospital had to do everything. We had behavioral health and chemical dependency and a NICU and a med-surg unit and a swing bed, and everything that you can imagine that we needed to have for our community, we had to have in that community hospital. And so got very good about learning about standards and regulatory requirements for various types of services and leading that group. And as our Catholic sister sponsors became smaller and smaller, our facility actually was sold to a very large for-profit chain, and embarked on a new adventure working for a hospital chain that owned many, many hospitals across the country, as well as managed over 450 hospitals. So became very experienced at that point in being able to be accountable financially, but also felt very supported in terms of the mentorship and the network that I was able to develop in working for that very large system. Currently, I am in a role as a nurse administrator in primary care at Mayo Clinic in Rochester. I have been so blessed over the years. When I accepted that role, I thought I was moving south, a little bit warmer from cold North Dakota, and I'm still kind of waiting for that warm weather to catch up with me. I haven't seen it here in not so balmy southern Minnesota. But I originally accepted the primary care nurse administrator position with a little bit of skepticism. So I was inpatient all the way, and I thought to myself, what's primary care going to be able to teach me that I don't already know? And little did I know what I was really getting into. And what I found was an entire world of nursing that I didn't even know existed. And I found it to be a fascinating, but frustrating, exciting, and fulfilling experience all at the same time. I came into my position at probably the absolute best time because we were about to change from what I would call a very traditional clinic sort of setting into moving into an advanced medical home sort of model. And so I've been able to be that sort of force of working over a long period of time in the evolution and the development of our nursing roles here in Rochester. When I came into my position, we had about 180 RNs and LPNs, and I'm proud to say at this point we have over 450 nurses that work in a number of different roles in our clinics, in our actually even beyond our clinics. We have evolved into having medical and behavioral health care coordinators in all of our locations. We have nurses who are working in skilled nursing facilities as an extension of primary care, working in our primary care house calls program. Our care team nurses partner with our physician colleagues in co-managing panels of primary care patients, especially those with chronic conditions. And lately, of course, have become COVID swab nurses, COVID triage nurses, COVID respiratory care clinic nurses, and hopefully someday soon to be the COVID immunization nurses. We've become a very versatile workforce, and I think our institution has even more recognized the importance of our community partners.
Thank you, Stephanie. We're at time, and so we're going to move on to a couple of questions that we have for you.
Great.
Jenny, you're muted. Okay, we're going to try it again. What do you see as the biggest AAACN membership benefit, and how would you like to see it expanded?
Oh, I think the biggest benefit of AAACN is the being able to learn from all of our members who are doing such wonderful, innovative things. Have attended many conferences and listened with amazement at all of the work that people are doing and all the activities that we can bring back to our organization. And then, of course, the networking. I've had the opportunity to work on many different projects with AAACN and work with many different groups, and they have both enriched me and really helped me think of things differently and move forward in ways that I wouldn't have done before. So the networking and the information and the education and the resources that AAACN brings.
Okay, thank you. And I do have one more question for you. What specific strength would you bring to the board of directors in relation to the role description?
I think, you know, maybe a little bit like Andrea, I'm a little bit of an introvert, but I think I'm a very good big picture thinker, person who looks into the future and says not only where are we now in nursing, but where can nursing move and where can our organization move in order to help prepare nurses for the challenges of the future. So I think I would be very visionary and sort of pragmatic, but also reflective and interactive with the board in moving forward in the direction that we need to go for the future.
Great, thank you. Chris, do you want to close us out here? I don't see any ending questions unless anybody has any.
All right, thank you so much, Jenny. Thank you to all of you for your time. What a qualified set of candidates we have. I know I personally feel like I've gotten to know each of you a little bit better. So thank you to all of the candidates for your time. Hopefully everyone feels like they've gotten a chance to get to know the 2021 AAACN director candidates a bit better. This is the first time that we're trialing this forum to get to know our candidates. So if the members think that it's helpful, we'll include it in next year's elections for both the director positions as well as the nominating committee candidates. And just a quick reminder to everyone that you're going to receive an email on Sunday regarding your voting, and we want you to be sure to cast your vote by December 6th of 2020. So thank you, everyone.
Thank you, everybody.
Thank you.
Thank you.
Thank you. Have a great weekend.
Thank you.
Bye-bye.
Bye.